Hey, good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System. Delighted to be back with you, broadcasting live from the Dolph Simons Family Studio on this windy Wednesday morning. How about that? Windy Wednesday morning. I rehearsed that. We are delighted to be back as the numbers...
Now say it 3 times fast.
No, that will only get me into trouble.
Okay.
Delighted to be back, of course, with my good friend, Dr. Dana Hawkinson, Hawkeye, and also joined this morning by an outstanding physician here at the University of Kansas, Dr. Ajay Nangia, Vice Chair of Urology here and an outstanding urologist who works here. He's going to give us an update today around the effect of COVID-19 on men and on male reproduction. But first, Hawk, how are we doing?
Well, we're doing good.
We are doing good.
Very good.
It's awesome.
Do you know the numbers?
I don't.
Do you want to take a guess? It's like the jelly beans in the jar.
Are we below 10?
We are.
Yes! That's the best!
Yay!
Like the jelly beans in the jar. I'm always right when I count those, even when I'm wrong. But, 8 acute infections right now with 2 in the ICU, 1 on the ventilator.
That's just crazy good.
20 in that recovery phase, and Hayes is doing well as also. 1 acute infection and 6 in that recovery phase, so 7 total.
And that I look at that KC.com, look at the numbers. Yeah, there aren't even that many new cases at all in Kansas City being reported.
I know. We've kind of the rolling 7-day average is excellent. The last couple days it's kind of plateaued just around 100. Let's hope that plateau stays or decreases.
Yeah, like 90 on one day. I think it's 93 or so. So it's really good. And why is it good? It's good because infection control works, and you're making it work for us. Yeah. And you can say that vaccine, people have had it, all those things are true. How much influenza do we have?
We still have none.
We have none. And you know why we have none? Infection control.
Yeah.
It works.
Goes with you wherever you are.
It travels with you wherever you go, and you're making it work for all of us. So thank you out there. Well, before we talk to Dr. Nangia today, let's first of all see if there are any reporter questions out there. All right, I'm not hearing any. Dr. Nangia, welcome here.
Hi.
How are you?
Great, thanks.
Good. How are things in urology?
Busy.
Yeah?
Busy. We're back to full speed.
So COVID-19, you hit a little bit, and then you bounced right back?
Yep. Everybody needs care at the hospital.
Excellent.
Yeah.
A recent small study out of Italy showed that 25% of men who contracted COVID-19 had a low sperm count 30 days afterwards. Talk to us a little bit about that, and what do you think of that study? I mean, some men even had no sperm after having had COVID-19.
So I think the whole thing about COVID, like any viral illness, is there's the acute phase, and there's the recovery phase, and then there's the post-viral stage. And like even influenza and fever, the acute phase often leads to the viral illness that may affect sperm count. There are other studies that were done from China that showed that happens more in the acute stage. And it's the question of how much recovery time has happened before you either see it in the semen or don't see it in the semen, etc., and the long-term consequences. This study, the average number of days from the average number of days from the time they were positive with their nasopharyngeal swab to the time they had their second negative swab was about 31 days. But the study looked at as much as 80 plus days after the positive test. And as you said, 25% of patients had effects on their sperm. Whether that's short-term or unfortunately long-term still needs to be determined. Interestingly enough, as you said, actually 8 of the men actually were from who had 0 sperm. Most of them had been in the ICU.
So just be clear, this is not a new technique of birth control, so don't think of it like that.
Not at all.
But is severity of illness related to whether or not you had a major impact on sperm count?
Yes, it did. 4 out of the 5 patients who were in the ICU actually were the ones who had 0 sperm.
Okay, so the sicker you were, the more likely. Now, would we see that with a really severe case of influenza or something like that as well?
Yes. I mean, they've shown with hepatitis and other viral illnesses and influenza, sure, you do. But the literature's weak. on this topic because people recovered.
And people didn't think about it a lot.
Didn't think about it a lot, right?
Yeah.
I mean, this is, as we know, it can be a deadly disease. So can the flu, but in smaller numbers and it's more virulent. But the long-term consequences, like any viral illnesses, whether it be influenza, I hate to use bad ones like Ebola or Zika or Hep B or Hep C, really can have consequences. But what's interesting about coronavirus is that, like mumps, which if an adult develops mumps without having been vaccinated, they can get testicular pain and lead to scarring of their testicles. Thankfully, due to vaccination and MMR, measles, mumps, rubella vaccination that we've given to children for decades now, though we don't see that anymore.
Yeah.
We do not see mumps to orchitis anymore. This, interestingly enough, in the Wuhan study, which is very interesting, that 18% of men who were in the acute phase of illness had testicular pain.
Wow. And so did you have to have testicular pain to see your sperm count drop, or could it drop independently of whether or not you had
We
pain?
don't know. I mean,
Okay.
in the Italian study, they didn't comment on that.
Okay.
But what's interesting is that even in the Wuhan study, their subsequent testing on the semen, which was about 31 days later from the acute phase or the positive test, showed no virus.
Okay.
The second study from China, however, did show about 16% of men had virus in their semen, but the average length of time from when they were positive was only 16 days. So they were being tested a lot more acutely. So like any viral illness, you are virulent and passing on the virus, possibly even in the semen, possibly, in the acute phase.
And do we know, was that detection of RNA or was that actually infectious viral particles?
As far as I know, it was the PCR test.
Okay.
So.
Because we certainly know from Ebola, months out, multiple months out, there has been infection of a male who had it, and then several months later had, intercourse with his partner, his female partner, and she got Ebola. I don't know if we've elucidated any infection that way for this, but certainly, it's a concerning thing either for that way. But I think we still need to understand, is it PCR or what?
Yeah,
Have they
PCR.
elucidated any mechanisms about why your sperm counts are dropping, or do we think it's a general thing?
So, as you know, there's the spike protein, there's angiotensin converting enzyme. Well, guess what? There's ACE in the testicle. So it's an effect, and it leads to an interleukin response, which is what this Italian paper showed, which is an inflammatory response.
Yeah.
No surprise, really. But what's interesting about what you just said, Dana, is that all of these patients in this Italian study had 2 negative nasopharyngeal swabs.
Yeah.
3 patients, though, despite that, one was positive in the saliva, one was positive in urine, and one was positive in semen. Okay? So despite the nasopharyngeal swab, so I don't know what that means, in terms of PCR or whatever. But their partners subsequently were negative. I think that's important to know, that the little bit of transmission that happened chronically, maybe like I said, at 31 days or longer, that these were positive but negative nasopharyngeal swabs. Their partners were negative.
So let me ask you a question. Do we know if their sperm count comes back?
We don't know.
So one of the things, just one more reason, especially now for men and women, to practice good infection control is this concern about male infertility, and even to think about getting vaccinated.
Right. Well, that one is an interesting one. So you're absolutely right. First of all, the longest number of days that I could find in that Italian study that they had tested the sperm was about 80 days. We know it's about 90 days or so that it takes for a new cycle of sperm to take hold again. But you might need 2 of those. So we should be checking that in not just 3 months, but in 6 months to see if anybody rebounds or, God forbid, it's permanent. In terms of the vaccine, this is again straight out of our guidelines from our national organization, is any man who is eligible for the vaccine should not avoid it from a reproductive standpoint.
Yeah, in fact, you might even be encouraged to get it so you don't have this problem.
Exactly.
Yeah.
The concern about what? while there is a small concern, but we don't know the significance, is, as you know, sometimes people get that fever, sometimes after their second shot or maybe on their first shot. Whether that malaise can lead to a short-term decline post-vaccine, again, not been studied as far as I found thus far, but maybe, again, part of this.
But probably not going to lead to bigger consequences because you don't really have the orchitis and the other
Correct.
things.
That's right. Exactly. You are providing.
But I really like your point about the mumps and orchitis, and then this as well. I mean, that is just more information for parents.
Vaccination.
Get your children vaccinated. We don't understand what kind of complications happen because we haven't seen those things, but we know they do happen, and that's why the vaccines are so important, because it prevents our children from that suffering, from our young boys from that possible orchitis. But it can happen to women, I believe, or females too, with their ovaries, I believe, as well. So, get your children vaccinated. Call your primary care, your pediatricians. Get your vaccinations.
I mean, just to put it into context, in 25 years of practice, I've only historically heard of 2 patients I've seen with mumps orchitis. I've never seen it because of MMR, because of the vaccination.
So just an interesting question then to both our infectious disease and our urology guys. So if you have had this, does this mean that, let's say you actively have COVID-19 and you have sex, then could you spread this either through intercourse or oral sex?
I'm going to say no. We know for Ebola that can happen. It's well documented. And again, this is months after people have recovered from Ebola. But we understand Ebola is spread differently than coronavirus. Ebola is spread through bodily fluids, semen, blood, secretions. I don't know that we have a lot of evidence that you can spread it through bodily secretions of that nature, of this nature.
SARS-CoV-2 in this case.
For SARS-CoV-2, through semen, vaginal secretions. We know we can detect it in stool. We've heard about states and counties doing wastewater detection, but we don't know if you can really spread it. That means, or it's certainly not as much as that respiratory tract. So right now, my initial answer is going to be no.
Yeah, and I've been dying to answer that question because, truthfully, last time I checked, you can't have sex through social distancing.
Right.
Right? And unless you can have sex 6 feet apart, which is a miracle, I'd be honestly amazed if that was possible. My point being is you're intimate.
Yeah.
You're orally intimate, kissing, breathing in the same space, that you're going to get the respiratory transfer.
Yeah.
And the relevance, as I've said, unless you are acutely sick, and maybe then some in your semen, how would in this...
How would you ever differentiate which way?
Right. And only if you're really probably quite sick. I mean, having sex when you're quite sick might be just a little bit too tricky.
So I was going to say, otherwise it'd be masks on, pants unzipped, and that's a funny one.
Indeed. Yeah. That would be quite the sight.
Yeah.
Or not, as the case may be.
But I think
we're a family show,
to
so...
your point, more studies in that convalescent time of the semen is definitely warranted.
Yeah, and I think the important question is, as this study and is implying, or at least trying to figure out, as the Wuhan and all, is in the recovery or post-recovery phase, are you concerned about a sexually transmitted infection? The answer is no, not probably. But again, because we are intimate in the respiratory arena, that is probably not. It's not like Ebola, not like Zika. Zika had an effect also.
Correct.
Zika had an effect on the fetus, the anencephaly, the effect on the brain on the child. That's not been described, as I know you've talked to OBGYN and maternal fetal medicine doctors. That hasn't been the case. So not that there's a so what, but can the female partner get coronavirus through oral sex? So only I'd probably argue, and again I don't know, because again it's respiratory, is whether if there was in the acute stage virus in the semen or the urine, which I'd be hard pressed to think that was the primary method.
Okay. Well, Jill, let's see if there are other questions out there for...
We do. And we actually have questions on topic.
Awesome.
And we do, however, for just 1 second, we do have a reporter question from Donna Pittman at Channel 9.
Please.
And Donna wants to know, do you mind saying when the last time was the numbers were this low in terms of inpatient?
Wow, it is really low, Donna, and I got to tell you, this feels really good, Hawkeye.
It feels, great. I mean, I don't think we should be as happy as we are, really.
Right.
And
I'm not going to gloat.
No, But we are optimistic that it will continue to be like this.
And we're not going to go out into a large group without masks on and have a big party in a closed space with no ventilation. That would be bad.
Right. There's no mission accomplished party going on here
No,
right
nothing like that.
now. I think David Wild was on yesterday and answered that question. Was it maybe June?
I think it may have been before June. I think we
June.
may be reaching back into April or something when we think about 8 patients. But let us find out the answer to that question and be back with you, because we are so excited about it. But because what we also like is the overall trend, because it has been dropping. We keep thinking, okay, it's a plateau, and we were back down to under 20. All right, plateau is 18, so we're going to stay there. Because we've all thought that we're going to see this disease continue to be a problem in our hospitals. Not like it was, but certainly a new disease, still having a lot of patients, et cetera. But to get down to 8 and a couple of people on ventilators in the ICU, I mean, it's still bad. But my gosh, it is so much better than it was. And the question is, what will it look like when we get everybody vaccinated? I think we're all delighted. And I think it just tells us that, again, we keep stressing this, infection control works. Don't go, the temptation is so great that just take off our masks and relax. And I just say to you, please be careful, be thoughtful, make sure you do it with the right group, make sure you do it at the right time. Don't go into large groups, don't go into really packed restaurants and not have your mask on, because it is still out there. Community spread is still out there. We are still seeing new cases. As we said, there were still 100 positive new patients here in Kansas City yesterday. So it's not like it's gone. That's a big day. And so, but it's just a lot better. We want to keep it better. And the other problem we know is that when we looked at our overall numbers yesterday, and they were reported today in the Star, the mortality rate is still significant. Once you get hospitalized, it's not like your chance of death is 0. It's still pretty darn high. It's between 10 and 15%. So we still got to be really vigilant out there.
And the health system has been listening. And Gina wants Donna Pittman to know that she looked it up. And March 20th of 2020, we had 8 active cases.
Wow. First of all, the health system is listening. That sounds spooky to me.
Gina's on top
I love
of it,
it.
man.
Way to
Thank
go,
you, Gina.
Gina. Thank
She's
you.
bright and quick.
Yep.
Gina's
8,
great.
March the 20th. Holy cow.
But this is not still a lull from like post-Christmas, New Year get-togethers and the cold weather of winter and this winter storm that we had that kind of kept everyone in. This is not a residual effect that we're seeing a lull down now.
We think it's a little. We think the weather had an impact because it
I
drove
think the
some
weather had
people
an impact.
inside. They didn't go out.
The winter
They didn't go
doldrum and
gather.
January, February, March. I mean, people just don't go out
But,
as much.
There's also the impact of people who have had the disease and the impact of the vaccination,
Vaccine.
and
Yeah.
especially the impact in nursing homes, because we know that those are over, our average age is 58. So half the patients are over 58, right? And so a lot of those were coming from nursing home and congregate living facilities. And so if those people have been vaccinated, it makes a huge difference on our census. That's why I say to just be careful, because schools are reopening, restaurants and bars are reopening, and that's all a good thing to do. But wear your mask. Don't get cocky. Wear your mask when you got to eat. Then take your mask off and do that. But don't get too comfortable with yourself here, because the numbers can easily go right back up, and especially as these variants are still out there, Hawk.
Yeah, and that is a large concern. We don't want the numbers to go up, but we're always prepared for that. There is concern because of these new variants, and again, it's not only the variants that we know about. It's the variants we don't know about yet. We have to assume that more variants are out there. It's just what proportion, and really, is there any change in the clinical, the course of the disease? Is there increased mortality or what? Are some of these variants more transmissible? It looks like maybe the UK, the B117 might be more transmissible due to the binding to the receptors, or because you may shed for longer periods of time. So those things are still trying to be identified and elucidated, but just keep doing what we're doing. And we know it's nice out now. People are going to want to gather. Certainly outdoors is much better than indoors. Don't let down your guard. The Big 12 tournament, NCAA tournament is going to be happening. People are want to gather, whether
Kauffman
that's
Stadium, Royals baseball is going to start.
That's outside, though. That's good.
People, I know, but still.
But people will want to gather and just
They wanna
be
gather.
careful and do it in a thoughtful manner.
Okay, 2 follow-ups to this, and then we're going to get to Dr. Nangia's questions. But Marilyn says, Gina, if you're still listening, she'd like to know if we could share the day we have the highest numbers. I'm going to guess it's in December, because I think I remember you
Yeah, it's
saying
late
we have
November, early
101 acute infections.
Yeah.
I think we got up
That's
to 110
concerning.
at one point during a day. I'm not sure that was actually the official midnight census, but
Yeah.
at one point during a day, we were up 110, 111 acute infections. And just so the audience out there knows, we technically do our census at midnight. There's a lot of Medicare rules around what time of the day you count your census and what are the number of patients you have of any kind of disease in bed. So during the day, before people go home, we may have a higher number of acutes, and then everything kind of goes home, and we consider that the settled census. It's called the midnight census. But I think we got to 111 at one time point in one day. I think that was our highest actual count. But we'll see. I'll get checked on that.
Okay, and Diana doesn't want to burst you guys' bubble, but she said yesterday the CDC tracker showed a huge increase in cases, 150,000 versus the 50,000 we've been seeing. And she said in Missouri tracking map showed several northern counties, in critical status again.
Yeah.
400
Actually,
plus cases per 100,000. Did something happen? Is it an outbreak or a reporting error?
No, well, yeah, it could be all the above, and I don't know enough about that specific point. But what I would say is it doesn't burst our bubble at all.
No.
We're super happy.
Yeah.
But as we've said all along, it is still out there. There is still widespread community transmission. So it is not surprising. And if people are taking their masks off and going outside and gathering, the numbers are going to go back up. And I fully expect that to happen. Let's be clear.
Yeah.
I think we fully expect
Yeah,
that
we
to
do.
happen this spring. The only thing that will mitigate it is going to be, A, people have had COVID, so they may not get it again or be as likely to get it again. B, vaccinations, especially amongst elderly, those over 65 and in nursing homes. And then ongoing vaccination. And C, a little better masking culture than what we had. In some cases, a lot better. Those are the things that will mitigate this. And so hopefully we won't see the really huge spike. It is not a surprise to me, though, as people go outside and gather, that we see more disease again.
Yeah, and the higher ups, the CDC, NIH, they've all been concerned because we did reach a plateau nationally. And their concern was that we reached a plateau, we didn't continue to decrease. So there was a thought that, well, now if we do have any of these variants and we have increased spread, that could certainly shoot up the numbers. So, we're certainly concerned about that. We always are. We're always preparing for more hospitalizations. But looking at our local Kansas City area and the trend or the rolling 7-day average as it's reported, we're certainly happy about that. But we are always prepared and cognizant that it can change in 1 or 2 days. So.
Okay, a couple questions for you, Dr. Nangia. Isaac wants to know, he heard you say the concern about maybe getting a fever from taking the vaccine, but his question is there any plausible mechanism for which the vaccine could cause someone to have infertility?
The truthful answer is I don't know.
Although, in fairness, do we see it with any other vaccination?
No. We don't generally see that with any other vaccination.
And we get a fever and we get we
Right.
get issues. And the MMR would be the one you would kind of think, oh my gosh, I wonder
Right.
if that's going to cause trouble, and it
It
doesn't.
doesn't.
So I think the likelihood is going to be low.
Yeah, and I like that question because they're asking about a mechanism. I can't comprehend or understand how that mechanism would be
Right.
for all the reasons that we have stated.
Yeah.
Okay.
I mean, it should be no different, but like I said, like any vaccine, you will just need a little bit more data and time.
Okay. Jeff wants to know,
But can we back up? I want to make sure people out there don't get confused around this point. The likelihood of the vaccination causing effect on male fertility or female fertility is remarkably, vanishingly small. The likelihood of COVID-19 causing an impact is
a possibility.
Yeah.
There is definitely that, which we don't know the long-term effect. But
and
again,
there's data that says it does happen. We just don't know if it's
right. And I don't want to reiterate what Steve just said about the vaccine. I don't want to put some fear-mongering out there about the vaccine. All right. But let me put it into a bigger perspective. Only since 2011 has the FDA been checking whether our regular meds, some of them, are an effect on sperm. All right, just to go to a bigger picture, all right? So it's not like this is unheard of, but we just don't have data. We have animal data. The vaccine should not be any different than any other vaccine. I just know that, like everybody is anxious about the vaccine, whether to take it or not, is basically some things we just haven't got long-term data on. But I agree with Steve and Dana that it shouldn't be any different long-term.
and you strongly recommend it.
Oh, and I absolutely strongly recommend the vaccine.
And
so
you got
that
the
should
vaccine.
Not, yes, and I've had the
and
vaccine.
you recommend it for your children.
And I recommend it for
And
my
your
children
wife.
and my wife. And more importantly, I'd recommend it to any man who I see for reproduction. So therefore, put my money where my mouth is, if you will, or my opinion, is there it is, all right? So I would not change my practice from the vaccine. You're more likely to get sick and have problems if you got coronavirus. I think that's what we're trying to figure out here, right? So rather than having the fear of the vaccine, I think you should fear the virus.
Exactly. Thank you.
Great.
That was
Greatly
perfect.
stated.
I like that.
Yeah.
I'm going to
Very
steal
clear.
that
You
line.
can take that.
So,
Yeah.
Jeff's
Cut
got
that,
another
boys.
one. Oh, I'm sorry.
No, let's talk about that.
Okay, Jeff's got another one. Jeff wants to know, is there any impact on testosterone levels in these men, or was it just sperm count?
So there is some effect. In this study, they kind of implied that there was an effect on the Leydig cells, which are the testosterone-producing cells. Again, any acute event that can lead to feeling sick, and we say constitutionally in medicine, meaning overall, systemically, all parts of your body, can affect your testosterone level anyway. Again, so any viral illness could do that. What would coronavirus be any different? Probably not, but again, we need to catch people in the acute setting, and we need to catch people long-term in the recovery. And like I said, even surgery can lower your testosterone level. So, and that can be, another comparison. But we don't, again, know the long-term effect of coronavirus on this, and people especially who may have been quite sick.
So really, we have to catch SARS-CoV-2 in the act.
Basically,
So to
I mean,
speak.
if we truly could do this, sadly, prospectively, which we've been doing since this happened, is basically getting all secretions and all sorts of measurements of people, and then try to track them long-term in those patients that recover or otherwise.
And Diane wants to know, when you talked about the absence of sperm, whether it might be permanent or not permanent, if you could elaborate on that. I mean, is it numbers that you're looking at in a sperm? I mean,
Right.
obviously it's a count, but...
Right, so there's no kind of if, ands, or buts. When I've said there's the technical phrase called azospermia, that means zero. Repeat, zero sperm. And there are cases of people who have had that in this Italian study. Mostly, 80% of those who were in the ICU initially, which was 4 out of 5, it wasn't many. So we have to remember these studies are small to make a big statement. But they were zero. And again, this could happen from just being sick in the ICU for anything, pneumonia to other medical problems, right? Just because you're quite sick, and that has been been understood, that kind of the overall body being under an inflammatory state can often lead to an effect on sperm. Maybe it's down to zero, but the question is how long for?
Okay. And now, general question. Carol wants to know if we have any word on when the Long Haulers Clinic will open to those outside of the current KU population.
Well, gosh, I think it was like really soon.
It was. We had to delay it just a little bit because we did have an expected increase and, kind of getting close to capacity even with our patients. So we had to delay it a little bit. It should be in this month of March. But we are actively working on that because when we do get those referrals, we want to make sure that we can expedite those visits for the people that need it to those specific specialties that need it as well.
And lots of concerning data coming out about the long hauler syndrome, especially the kind of delayed effect around 3 to 6 months and people becoming ill from it. So I think it's going to be really important. We are going to get it there, though. That is our absolute obligation to do.
But we've had a good... it's been received very well from our patients, and so that's why we've kind of had some capacity issues and the ability to get to people where they need and to be seen in an expedited manner. So we want the same thing for the external referrals. So we're just working on those capacity issues.
So I think, Melissa, and I think this will probably start with you, Dr. Stites, because you have mentioned in the past when you've been visiting or teaching on this subject that the virus doesn't care who you are, how old you are, where you live, all that kind of thing. So Melissa's question is, she's really worried about her kids. If the adult population gets vaccinated, then will the virus go after children? She's wanting to know, are they going to become more at risk?
Yeah, that's a great question.
Or
The virus,
and when they might get vaccinated?
yeah, the virus doesn't discriminate, but the virus is not intentional, meaning that it's not going to go say, I can't get into adults, therefore I can get into kids. We'll take that over. Because the virus can go into kids right now and does and tends to not make them as sick, although there's increasing concern about the inflammatory response syndrome afterwards. Yeah. So I don't think it will necessarily accelerate in children per se. Now, a variant could easily decide it's more easily spread, it's got even more respiratory spread, and the vaccination still is effective than the adults who've been vaccinated, then it will leave the kids, and if it's much more communicable, then it could feel like it was also intentional, meaning I'm going to go select out and find people who are less than the age of 18. But the virus can't tell that, right? It can't do that. It's kind of deaf and dumb and blind in that regard, which is why it doesn't discriminate, because it is deaf, dumb, and blind. But it lacks in willful intention outside of wanting to go find a host somewhere, Hawk.
Yeah, and we know children can spread the disease. It might be less when you look at household studies. There's certainly more of a risk of the rest of the household getting it, or the household attack rate, if an adult has it and brings it into the household versus if a child has it and brings it to the household. But we know that the important thing here is getting as many people vaccinated as possible, and right now that is adults. So by doing that, you are overall going to reduce the spread of the infection. And so I think that, just as you said, I don't think it's going to make any more worse clinical outcomes for children. I don't think it's going to change the clinical pathology of this infection for children. But I think it's only going to be positive if we can get those adult populations vaccinated, because overall that's going to decrease the spread.
Cindy is asking, what about the impact of SARS-CoV on adolescent sperm as they're growing?
Good question.
Well, the truthful answer is I don't know. I mean, for the fact that, as Stephen said, as we think most young adults or adolescents have a milder form of this condition, although not exclusively always, right? I mean, the inflammatory response. I truthfully don't know, and it's not been studied, and it may be in the works, and people may be looking at that, like this Italian study, but it's not published as far as I know right now. But it's a fair question, and I just don't know. And I think the long-term effect is still to be determined. And, I hope young adults or young adolescents who are male or female, I guess, who unfortunately have a severe case of it, will just have to be monitored for the inflammatory syndrome, etc.
Okay. Jennifer is asking, as Johnson County schools get back to fully in person after spring break, and everybody's going to want to go to church at Easter, she's wondering what your thoughts are on staying safe.
Yeah,
and
so
are you going to go to church on Easter?
I think schools that are able to maintain appropriate distancing, I think will be fine. We've already proven that. I think if you're going to say we no longer need to be appropriately distanced and we can take off masks, I think you're going to spread the virus, right? Because there is still community spread, as the other listener pointed out, in northern Missouri counties and other counties throughout both states. I think the same thing can be said of any event where people are gathering together, and we know that church is a concern, especially if they're going to be singing without masks on. That will become a community spreading event. We will see the numbers go up reliably unless so many people have had it and so many people have been vaccinated that it keeps it at bay. But the moment you let down your guard on infection control is also the time when we start seeing the spread of the disease and back to more significant levels than we've had today, Hawk.
Yeah, I agree. I think it starts with get-togethers for basketball now. It goes into spring break and traveling and getting together for that. And then, of course, Easter. I'll be attending Mass. I know that a lot of churches, we certainly know the Archdiocese around here, they have pretty good general rules about singing, just as you said, masking. We would hope that other independent churches or parishes would continue to try to do the spacing, masking, no singing. It's all about risk mitigation. And so if we can continue to do that, I think everybody will be safe. If it's nice, but we never know how it's going to be on Easter. It could be freezing that day. If it's nice, if you can hold an outdoor service, that's great as well. It's all about risk mitigation. Continue to do the things that we've talked about, and that is spacing, masking. Again, I think if we're talking about church specifically, I would agree with you. I think singing is more dangerous. That does bring a higher level of risk. So doing those things that we've talked about, and hopefully we can kind of keep everybody safe by continuing to do those things, continuing to mitigate and reduce the risk as much as possible.
So I think,
Hawkeye, wait.
Yeah,
I'm going to know Hawkeye. Jelly bean jar guy.
Yeah.
What was our highest census and what was the date?
Oh, man.
And don't consult your iPhone because you're probably on this text thread.
No. Let's see.
Because Jill was wrong. I'm going to give you a hint. Jill was wrong.
195 on December 12th.
Acutes.
Oh, acutes?
Yeah. I said it was
112.
It's actually 125, and it was on November the 30th.
Yeah, so I said December. I was one day off. But I was wrong.
Oh, you had an entire month to pick from.
I had the whole month.
That's 30
I did.
days.
I did. I said I
Jeez.
remembered in December. I remembered incorrectly. I'm
I
sorry.
try to forget those bad things.
Yeah.
I kind of flush them out of my brain anyways.
There you go, and we're at 8, and we could go right back up. If you're not careful at
Yeah.
Easter and going to church and
Yeah.
with schools back opening and all the other events, bars, restaurants, etc., I think reliably we are going to see another spike. It's going to come. It'll probably come in May and June. The counter is go get vaccinated because we know that everyone will have, we think that everyone will have access to a vaccination by the end of May, which is a remarkable statement. Now, I should back that statement up a little bit. We will have enough vaccine to vaccinate everyone by the end of May. Getting it into arms, then the logistics of making sure that everybody has the opportunity to be vaccinated is a second question. But hope is on the way. Hang tight. Don't let your guard down. Yes, I know we've relaxed a little bit. We're at homes and we're not masking inside houses and groups where we've all been vaccinated. But be careful, be thoughtful, and be vigilant. Because the story can change on a dime. And what you don't want to do is be caught with yesterday's news when the story is of today. Okay.
Oh, check your email.
What now?
And while you're doing that, I'm going to ask two.
I can't check my email. I'm sitting here talking to you.
Okay. Okay. Well, check your wrist.
Yeah, okay. Are you trying to tell me it was in December and they just changed the story? Because
They
before
did
said
just
it
a
was
little
going
bit.
to be.
They
Okay,
you know,
fine.
that just Amanda said, hold on. 12/11, 167 total, 101 active. And I think that's what I was.
No, that doesn't count. 101 active. We were talking about don't try and change the game here. You're
said
changing the
But
rules.
167 total. So the bottom line
That's
is,
not it.
it was high.
It was high.
It was very high.
You know, and again, I think I will continue to reiterate, I think we've been very lucky in the Kansas City area compared to some of our other brother and sister cities around the United States, Houston, Chicago, Detroit, New York, Los Angeles County. You know, we've been very lucky. It's all because of the people and the community continuing to do the right things and hopefully keeping the numbers down.
Two really quick.
Two quick questions.
Two
Okay,
quick.
Chadwick, let's
yeah,
go.
because they're important.
Not in case you broke your wrist.
All right, thank you. Tricia says, my daughter who is 22 has been given the choice of vaccine because she has an internship in a healthcare setting.
Go get it.
Do you think that when she has a preference, should she get it? She's healthy.
Oh, there's no question about it. Go get the vaccine.
Get it.
We know if nothing else, it will protect everyone else around you because it does reduce the risk of transmission, we think, by 3/4, 2/3 to 3/4, and maybe more. So, yes, get the vaccine. There should not be a hesitation, not a single bit.
All right, and last question for today before you guys do final comments is Linda says she heard that from some nurses to receive your second vaccination in the opposite arm. Is that a good idea? Or
No,
should
it
go
doesn't
in the
matter.
same arm?
You know, all of the immunogens, really the spike protein, all of that stuff, it's going to get taken up by cells locally in the muscle. It's going to drain to the local lymph node, which kind of is in that axillary or armpit area. We've had our breast ultrasound and mammogram people on who've described that as well. So it's not going to really matter. You're still going to have the circulating B and T cells to identify that spike protein and boost that immune reaction. So it doesn't really matter which arm you get it in.
And Tricia says that she just wants you to know, too, that her daughter had childhood leukemia and is a survivor. Does that change your thought at all about
Yes,
getting
it's even more important to go get the vaccination.
Get it.
Yes, do it. Do it.
Be thankful you can be getting it.
That's exactly right. Hey, tomorrow, the perfect storm for increased addictions. You know, we've seen a lot of stuff out there about increased domestic violence, alcohol, drinking, and different things, and concerns about addictive behavior. So tomorrow, the Addiction Clinic Medical Director, Cindy Brooks, and Addiction Clinic Nurse Manager at the University of Kansas Health System will join researcher Dr. Ann Bizzardo here at the Med Center to share news of a new shot delivering a proven medication to treat opioid and heroin addictions. The pandemic, coupled with a reduction in being able to be in therapy and maybe even having personal contact has created a perfect storm for increased addictions as well as an increased desire to get off pain medications. So seniors also make up a big part of that. So we'll be talking to Rupa Sethi, who is the Addiction Clinic Medical Director, and Cindy Brooks, as well as some research folks. We have a really big thing coming up. This new delivery mechanism of how to get off these things is considered a game changer. So I invite you to be part of this conversation because addiction is a powerful disease. Final thoughts?
No, I'm thankful, grateful that you would allow me to talk about this topic. I mean, we know this is going to be a topic that covers all subspecialties in medicine. I will be interested, as a final thought, of what the birth rate is going to be post-COVID.
No, isn't that, again, it will be interesting.
Whether
You know,
there was
we
a
know for a
increase.
while there was a big decrease because
Interesting. People were
our
scared.
Dr. Carrie Weinecke was our, sorry about that, Dr. Carrie Weinecke was here talking about the drop in their new OBs. And they thought it was really related to people just being scared. And
Yeah.
now they're seeing a bump, and then they're seeing a rise here as
Yeah.
people start to get a little more comfortable in
That
their
will
home
be
a lot, I
interesting.
think. Yeah.
Yeah.
So we'll find out. But thank you for being on the program. I'd love to have you back. And
Thank you so much. Thanks, David.
thanks for helping us have a delicate conversation, really, about a difficult subject and raising our awareness about the potential for male potency issues related to SARS-CoV-2.
Yeah, thank you for coming on. I enjoyed your expertise and your points about SARS-CoV-2 coronavirus infection and your statement on getting the vaccine, but also the statements about other, just vaccine preventable diseases in general. So again, you heard it from Dr. Nangia, get your coronavirus vaccine if you're offered. And then otherwise, for pediatrics out there, please, for those vaccine preventable diseases, continue to meet with your pediatricians and your primary care physicians. Get those vaccines because we know that by getting those vaccines, we can prevent so much suffering and pain for ourselves, but also for our young children as well.
We've said since the beginning that we are building the airplane while we fly it. And we know a lot more about flying this airplane than we did. But we don't know all the destinations, and we don't really know what storms are out there. So you have to do those things that keep you safe. Vaccination keeps you safe. The rules of infection control keep you safe. So while you fly on your own personal airplane, remember the story of SARS-CoV-2 is yet untold. But the way you can make sure your own personal narrative stays intact is to remember the rules of infection control. And while you're flying that plane, remember that those rules travel with you wherever you go. We'll be back tomorrow. We'll see you soon.